Good day everyone, welcome to my channel. On today's tutorial, we'll be taking a topic under gross anatomy under the upper limb called the muscles of the scapular region. Before we start today's tutorial, I would like to tell you something. The muscles of the upper limb are divided into 5 regions, and these regions include the scapular region, which we are treating today, the shoulder region, which I will teach you very soon, the arm region, where you see the bicep, the tricep, the brachialis, and the coracobrachialis. We also have the forearm region, where you see all the flexors carpa ulnaris, flexor carpa radialis, the brachioradialis, the pronator teres, the pronator quadratus, and the rest. And the last region we have is the hand region, which is here. This is the hand region. In the hand region, you know the muscles we have there, all the pollicis muscles, the lubricants, the interossei, the tana muscles, and the hypothana muscles. So that's it. So we have 5 regions in the upper limb: the scapular region, the shoulder region, the arm region, the forearm region, and the hand region. So we have 5 regions in the upper limb. So let us start what we have today. On today's topic, we're taking the muscles of the scapular region, and they are 8 in number, like I have stated here. So the first muscle we have is the supraspinatus, then the infraspinatus, the rhomboid major, the rhomboid minor, the trapezius muscle, the levator scapulae muscle, the teres major, and the last but not the least, the teres minor. So the first muscle we'll be treating today is the supraspinatus. This muscle is innervated by the suprascapular nerve. Mind the term scapular nerve. Now this nerve innervates the supraspinatus, and this nerve comes from the lateral branch of the superior cord, of the brachial plexus. Yes, this muscle is found at the posterior region of the scapula. If you look at this diagram that I have here, if I show you the diagram, you will notice that yes, this is the supraspinatus. It's a small muscle here, a triangular muscle. It's found at the posterior region of the scapula. It's found on top the spine. This is the spine of the scapula. The next muscle we have for today, yes, this is the supraspinatus. I want to give you a clearer view of it, so you can actually feel it if you put your hand, if you palpate the muscles at your back of your scapula. You can actually feel it. Now, how you do that? Try to feel the spine of your scapula, then go superiorly the muscle that is there. That small muscle there, you cannot really differentiate because it will be under the trapezius muscle. That is the supraspinatus. So moving on. The next muscle we have for today is the infraspinatus. This muscle is innervated by the suprascapular nerve, just like the supraspinatus. Now it has the same source like I said before. It is from the lateral branch of the superior cord of the brachial plexus. So remember that. Yeah, this is the infraspinatus. It is a much larger muscle when compared to the supraspinatus. So if you look at it, one muscle is called supraspinatus, one is called infraspinatus. Now the reason is because the supra means superior, it is up, so it's up here. It is superior muscle, so that's called the supraspinatus. While here is inferior, that's why it's called the infraspinatus. Infra. So note the difference. The next thing we have is the rhomboid major. The rhomboid major is innervated by the dorsal scapular nerve. The dorsal scapular nerve originates as a branch of the brachial plexus which arises from the ventral ramus of the C5 foot. When you see this C5, what it means the fifth cervical root. We have 7 cervical roots. Notice we have 7 cervical roots. So this dorsal scapular nerve comes from the 5th root. Now, this is the rhomboid major. It is a large muscle. Here it is found connected to the medial border of the scapula. This is the medial border of the scapula. This is the lateral border, and this is the superior border. Now, this is the rhomboid major. It looks something like this, just like yes, looks like exactly how it is. Looks like the shape of a rhomboid, which is a quadrilateral, and it has some striations. So, if the dorsal scapular nerve gets damaged, it will cause some form of partial or total paralysis of this muscle. So therefore, when that happens, the function that this particular muscle is meant to carry out will be affected. Okay, the next one we have here is the rhomboid minor. So when you are studying gross anatomy and you see the term major, and you see the term minor, major, and you see another one minor, a smaller m. Now just know that the major is a bigger muscle while the minor is a smaller muscle. So simple as that. So the rhomboid major and the rhomboid minor have the same innervation, that is on the dorsal scapular nerve. Now you see this small muscle up here, that is the rhomboid minor, while under it you find the much larger rhomboid major. So you see this on both sides of the body, one on this side and the other one be on the other side of the body with their striations, like I told you before. So what this muscle does is to retract. It retracts the spinal cord, like it makes your back go backwards, something like that. So it retracts the back or the scapula. The next muscle we have here is the trapezius muscle. This muscle is innervated by the accessory nerve. It also receives proprioceptor fibers from the C3 and the C4 spinal nerve. Remember I told you that C means what? Yes, it means the cervical nerve. So it receives fibers from the third and fourth cervical nerves or cervical roots, put like that. Okay, so this is the trapezius muscle. It's a much larger muscle than what we have explained since. It looks like this. Yes, so this is how it is. Yes, so it has 3 fibers: the upper fiber, the middle fiber, and the lower fiber. Yes, it has the upper fiber, the middle fiber, and the lower fiber. The next one we have here is the levator scapulae. Just like the name says, it is self-explanatory. So it is an elevator. We elevate what? Elevates the scapula. So if the scapula is like this, something like this, it is found at this area. So it will take the scapula upwards. So it is carrying an elevation function. It's carried upward. Remember, why the rhomboid muscles, which are somewhere here, what they do is to protract. They make the scapula move backwards, while this one takes it up. So they are innervated by the dorsal scapular nerve. Now, this dorsal scapular nerve is a branch of the brachial plexus which arises from the ventral ramus of the C5 root, that's the fifth cervical root. Yes, this is where it is found. This is it. It is connected to the superior border of the scapula. Now, it does some form of upward movement. You take the scapula up. That's what this arrow signifies. So note that. So moving on to the next thing we have, the teres major. Yes, the teres major is a small muscle. It's long. It's not too big like the rest. It's something like this. Okay. Long and slim. Yeah, it is innervated by the lower subscapular nerve. It arises from the fifth and sixth cervical nerve. Remember, I told you that when you hear cervical nerve, that's the fifth and the sixth, cervical nerves. So note this. Don't forget to note it. So you have to note this. Yes, the fifth and the sixth cervical nerve. Yes, this is the teres major. I told you it was this slanty muscle which moves from the inferior border of the scapula to the proximal region of the humerus. Remember, a recap that here, which muscle do you find here? Yes, this muscle here you find is the infraspinatus. What muscle do you find here? Yes, it is the supraspinatus. Which muscle do you find attached to this superior border? Yes, it is the levator scapulae. The next muscle we have here is the teres major. The teres major is innervated by the axillary nerve. The axillary nerve is one of the major nerves that you find the upper limb. It innervates the deltoid muscle. It passes through the surgical neck of the humerus and stuff like that. So the axillary nerve is one of the terminal branches of the brachial plexus, derived from its posterior cord. Yes, from the posterior cord of the brachial plexus. The brachial plexus has two kind of cord: the anterior cord and the posterior cord. So yes, this is the teres minor. Is similar to the teres major, but it's mostly found covered by the teres major. What do I mean? So remember the diagram that I showed you. The teres major is around here. Sorry, I'm using the wrong thing. Yes, the teres major is around here. Yes, and it goes under because it's going to come out from the proximal part of the humerus here, and the infraspinatus is here. It will still cover part of it, and some other muscles will still cover it, making the teres minor a little bit protected by other muscles. So it's not so subcutaneous. Subcutaneous mean it cannot be felt through the skin. Put it like that. It's close to it's not close to the skin. So everything we have studied today, we studied 8 muscles in the scapular region. Yes, 8 muscles in the scapular region. The supraspinatus, which is innervated by the suprascapular nerve, the infraspinatus, the same nerve, the rhomboid major by the dorsal scapular nerve, the rhomboid minor by the dorsal scapular nerve, the trapezius muscle by the axillary nerve, the levator scapulae by the dorsal scapular nerve, the teres major by the lower scapular nerve, the teres minor by the axillary nerve. So these things are very simple in exam conditions. So just note this. There are key ways to remembering this now. All the muscles of the scapula they mostly have to do with scapula. That key word scapula is there in a good number of them. So remember this: the rhomboids, that is the rhomboid major and the rhomboid minor, they have the same innervation, which is the dorsal scapular nerve. The supraspinatus have the same innervation, which is the suprascapular nerve. The levator scapulae has dorsal scapular nerve, just like the rhomboid muscle. While the other two, while the other three muscles that are different from the rest are the trapezius muscle, the teres major, and the teres minor. So the trapezius muscle is from the axillary nerve, or sometimes you can see them write CX to CXI, something like that. You will see something like that. And the teres major is from the lower subscapular nerve, and the last one, the teres minor, is from the axillary nerve. So go through this video 2 times, 3 times, drop your comments. If there are any videos you want me to make for you next, just put the topic, the title, or your questions, and I will answer all of them. So thank you for your time. I wish you good luck in all your upcoming exams. Have a nice day. Thank you.